Hi everyone, I'm Dr. Rajvi Chaudhary, founder of GSNMH. I am an MBBS and a medical writing scholar for Harvard Medical School. I'm also an incoming health informatics student at Rutgers University this fall in US. I'm delighted to welcome you all to our second session, which focuses on physician burnout, where we will explore ways to support the mental well-being of healthcare professionals. With that, I will hand it over to our moderator today, Dr. Janvi, to lead us into this important discussion. So over to you, Dr. Janvi.
Hello, good morning. A warm welcome to today's discussion session hosted by GSNMH, the Global Society for Neuroscience and Mental Health. My name is Dr. Janvi and I'm currently working as an intern doctor in Vadodara, and I'll be your moderator for today's insightful session. We are truly honored to have with us Dr. Namitha R, who holds a Bachelor of Naturopathy and Yoga Science degree and is currently serving as the District Program Manager of the State AYUSH Society in Tamil Nadu. Dr. Namitha brings a unique blend of clinical knowledge and administrative expertise, and today she'll be sharing her thoughts on a very important topic, physician burnout, something that affects the well being of doctors and the quality of care they provide. Welcome, ma'am.
Good morning, ma'am, and thanks for the warm welcome. And good morning, all. This is Dr. Namitha. I'm holding a Bachelor of Naturopathy and Yoga Science, and I'm currently working as District Program Manager in Tamil Nadu in State AYUSH Society. Now, moving on to our session. Before that, first of all, I would like to extend my sincerest gratitude to GSNMH because, like, whenever I reach out to them, they are very kind enough to receive me, whether writing my blog articles or while the current discussion. So I'm very grateful to Rajvi ma'am, and I'm glad to know that this organization is passionately working on mental health. And when I am given a complete freedom to choose over this topic, I didn't have a second thought because physician burnout is something that is needed to be addressed on a regular basis to ensure the complete well-being, physical, mental, emotional well-being of the physicians. And yes, it is too early for me to take this topic. I know because I graduated since a year. Now I'm in administrative sector, and it's early to speak about this. When I chose this topic, immediately I gathered all the information from my dear allopathic doctors, and I took like 40 concerns and gave it to ChatGPT, just aligned beautifully. Then Rajvi ma'am came to me, no, it's for physician burnout for Ayush doctors. I was like, too surprised because this is currently relating to me. So now moving on to our topic, physicians burnout in Ayush doctors. Now let me share my screen for better understanding in the presentation.
Yes. And pleasure is all ours, truly. And thank you so much, Dr. Namitha.
Thank
So
you.
how this session is gonna work out like this. So I'll gonna ask questions to Dr. Namitha and she will answer along with the slides that she made. So let's get started. So I hope to, yes.
I'm sharing my screen now, ma'am.
Okay.
So the topic is physicians burnout in Ayush system of medicine. Moving on to
Okay.
our introduction.
I'll start asking question. Okay. So let's start with introduction. Yes.
In even allopathic doctors, Ayush doctors too face stressors, but in a unique way. And I would like to address those stresses after ma'am's questions. And over to you, ma'am, for the questions.
Okay. So from your experience in both clinical naturopathy and healthcare administration, what
Yes.
unique stressors do physicians in Ayush system face?
Yes, ma'am. The unique stresses Ayush system of medicine physicians mostly face is more of emotional strain than the physical strain. Our physical workload may be like yes, it's like kind of 9 to 5. But our emotional strain is more than the physical strain. So this is the first stressor, ma'am. The second stressor is like we are always sidelined as alternative or non-essential. And the second stressor is we are like on the external perspective, we are less essential than the conventional medicinal practices. So these are the main concerns. We are considered as mixopaths. So these are all the emotional burdens we carry on the daily basis.
So true.
And the next is sometimes you are undervalued, and sometimes the institutional hierarchy pressures also sidelines us. This is done on a daily basis. So we have to work on to prove our worth, that feelings of inadequacy in this kind of demanding work environment. Because we work along with, sometimes we work along on a allopathy setup, we have given a Ayush wing near the allopathy setup. So the importance of allopathy is more than compared to our Ayush system of medicine. So these are the unique stresses we face on a regular basis.
Yeah, this is actually a very much important topic to talk about, because no one thinks about our emotional well-being.
Yes,
Because we are expected to look like I said in my earlier video, that we are expected to look strong outside even when we are suffering from inside.
Yes.
So even when we are having some kind of mental health issues, we are not given that much time to work upon it. So I think you are very right about this. And so, yeah, we will move to the next question.
Yes.
How can naturopathy and yogic practices be systematically integrated into the daily routines of healthcare professionals to prevent or manage burnout?
Ma'am, as far as yoga and naturopathy is concerned, when I took up this course, I just knew yoga as a posture, just a asana. But yoga is more than that. When I studied my second year, third year, means yoga, then only I came to know yoga is much about knowing ourselves from the inside rather than the physical appearance. So then what I came to know is while working, we definitely experience stress, and how to combat that naturally. Now, in the recent times, I see many of the working professionals are under medications now, antidepressants. Then, what sort of psychic medications they take? Everyone, whoever I meet, they say, I'm in anxiety, I'm in stress. So whoever I meet, these are the concerns they say to me. And I say few words to them. It is PBRR. Pause, breathe, rest, and relax. Give yourself some time. Then everything will be sorted out. However, the big issue is just pause, breathe, rest, and relax. This is my only current like mantra, I would say. And yoga and naturopathy is not just a life science, ma'am. It is a way of life. We have to it is not like doing only like, I would never advocate do only yoga. It is a form of physical activity. But as far as yoga is concerned, yoga blends body movements, breath work, our mind thought control, uh, then our inner emotions control. So it blends body, mind, and the soul. So this is how yoga works. And like every other health coaches say, I would also say, go just be in the present. But our regular basis is not like that. We just run. Every day is like a rat race. We just run for the day. But every day we have to focus on our physical, mental, and emotional well-being. For that, we just need to follow our routine. on the regular basis of daily 45 minutes to 1 hour of physical activities must. If a working professional who is doing a heavy work, even our physicians, they can do at least 15 minutes for their body they can dedicate. 15 minutes, it's not much in 24 hours. 15 minutes is ideal for them to dedicate to move their body, apart from their consultation works. The next is sleep hygiene. Sleep hygiene is more essential, and I am also learning now about the sleep hygiene. So sleep hygiene is essential. So 7 to 8 hours of, I wouldn't say good sleep, it is a sound sleep. So sleep is essential. Next is the diet management. Right choice of food is what the person is. They can eat whatever they want, but moderation is the key. We can't advise or advocate every individual to eat this, because eating is their right and their preference, but the choice should be right. So that is, we advocate diet management. Then I used to say my clients, like, follow 5 to 10 minutes of meditation. Sit quietly for 5 to 10 minutes and observe your thoughts. If your thoughts are very rushing, just try to calm yourself. But in the recent days, I understood whatever work you do with focus, even that is meditation. That is mindfulness. The work you do, even if you drink a sip of water, you remember that you're drinking that sip of water, that is mindfulness. And that is meditation. So this is what mainly yoga and naturopathy does to our daily life. It is actually related to the daily life.
So true. Actually, this last thing that you told, that even sipping, when you are sipping water, just focusing on that is also mindfulness. So we just don't usually do these things because we are on the autopilot mode, and we are into the rat race because we just wake up and we just run to our work and then come back and then sleep. But it is very much needed to give at least 15 minutes in a day, as you said, because it is a very small time. I
Yes.
think actually, by without, like, if we can stop using Instagram for 15 minutes, and then we can, give 15 minutes to our well-being. So it is very true that we need to focus on that. So yeah, so I'll jump to the next question. As a district program manager in the State AYUSH Society, what policies or initiatives have you seen or implemented that effectively support physician well-being at the systemic level?
Ma'am, government has immense policies to support the public as well as the physicians, ma'am. As far as government sector is concerned, physicians have constant work still with leaves. So they can take their medical leaves, they can take their casual leaves, but for proper reason, everything they do. In government sector, it's like this. And for public also, the government has done so many schemes. I would like to elaborate that too, but in a different session. But for our topic now, Ministry of Ayush has launched an application called as Y-Break, a 5-minute yoga protocol app, ma'am, that is featuring asanas, breathwork, pranayama, and 5 minutes of meditation, dhyana, for all the workaholics. It is not only for physicians, but for all the workaholics. This Vibrate app is available in Google Play Store now. And to address the practical constraints, government also has the initiatives for transportations for the medical officers to go for the camps, come back, then accommodation, then medical equipments. They ensure the availability of the medical equipments in an under-resourced setting to ensure all the supportive framework. And they regularly monitor the doctors' performances as well through monthly meetings, as well as the meeting involves grievances also. So they can convey the grievances from their side as well as the patient's query. And institutional support is definitely must for doctors also to they take scheduled breaks, ma'am. Sometimes in few corporate offices, they have also arranged yoga sessions, and few corporate sessions do that regularly. They follow yoga in their offices, and addressing their health concerns regularly to the officials is the main concern, ma'am. That is what the person should do actually. Yes, ma'am. So this is about the government initiative.
So actually, I want to share a light on a literature review that I did at Harvard when I was in a writing program. So as you said, I got to learn that we in the developing countries, the physicians are not given time for themselves as
Yes, ma'am.
compared to developed countries. I noticed that in the developed countries like US, UK, Australia, they give time. If someone is suffering from mental health, they can come back after they get better. But in India, there is still stigma around it, and people don't talk about it. And physicians, especially, they, as you said, they don't want to talk about that,
Yes,
and they will. I think government initiatives should focus on that as well, because.
yes,
Changing the mindset is very important when it comes to, because initiatives, government will implement
yes,
initiatives,
ma'am.
okay, but uh, to work it from the root level, we have to change the mindset.
Mindset.
And yeah, government have to give good transportation, accommodation, and medical equipment in under resourced settings, because it gives so much pressure to physicians to
Yes,
work in that under any under resourced settings. So that is also a stressor that we don't talk about much. That's a very much needed thing right now. I'll jump to the last question now.
yes, ma'am.
Do you believe administrative reforms or mindset shifts are more critical in addressing physician burnout in India? How can we strike a balance between institutional and personal approaches?
Ma'am, as you said, mindset shift is the priority, ma'am, because the reforms, even the institution, like they have changed their policies. Yes, you can open up if they say means the doctors sometimes suppress. No, we are doctors. We how can we just go and express our emotions? So that is not the kind here. Even doctors are humans too. Healers need healing too. That must be addressed in the real time, ma'am. And burnout is something, is not a weakness. You like, if you can, even if you're a doctor, you can go to another person who is non-medical and you can say, no, I'm not feeling well, and they say it's just take care. But it's not just take care. Burnout is not only weakness, it is an information from our body, and we need to listen to the body cues. And it is inner work as well as the external support, ma'am. This is what I feel. And as far as my role is concerned, I have ensured communication with the doctors, field level concerns. Now I'm working in an administration setup. I control 104 IRS centers, and I sometimes I monitor the activities of the wings, and I also listen to the field level concerns. I tally their census. Then we are also making sure the doctors are comfortable in attending their patients. We are ensuring the doctors' comfort as well, while we shift the doctors from one wing to another wing. So whether they can able to travel, are their health is supporting for the long hours to commute. So everything we are looking. So these are the administrative reforms as well. And doctors are also from their side, they are responsible for the cooperation to the administration level as well.
Um, Yeah, I just feel it, because I just also wanted to ask you one thing, like what have you felt as a doctor as of now? Like whenever you feel burnout and all, like what thought did you come, like come in your mind, because we just don't express ourselves as much as and especially Ayush doctors, because they have also have to work in every setting, and they are also working around the clock. So what did you like, what do you want to say about that?
Yes, ma'am. To talk about my personal burnout, I definitely experienced. Uh, and the sudden change to an administrative setup, this also was too heavy for me to process. It's been 4 months since I joined the administrative sector. I have been in observation for about 2 months. What is going around me? So how can I give my input? So everything was running around my back without me knowing physically. It was subconsciously. Even during my sleep, also sometimes I get, okay, what should I do in office, like that. But now I'm learning to manage that through regular yoga sessions. I give myself time for my yoga practices. Then I do breath work for 10 minutes, and I sit in meditation for about 30 minutes. But even though I experience from inside, sometimes I experience the anxiety and panic as well. But I'm learning to and coping up to manage it now.
Yeah, I'm just so proud of you, because it is very hard to, come out of, all of these things. And I have also faced burnout and everything, because we just have to do things, everything at once, and we are not given that much time. So I think we should have given time in between and for ourselves. And a training would be better also. Like if we are trained from the first year itself, that how to take care of ourselves,
Okay.
and so that would be very nice. And
Absolutely.
yes, exactly. And so that's nice. And so over to you, Dr. Janvi. What do you think, like what do you think physician burnout? And yeah.
Vision burnout. I just started my internship like a few months back, and I can feel a little bit of that even now. I've just started the internship, and I can see all the residents facing it on a daily basis. Like the number of times the residents have told me that they just want to leave and run away, and I'm like, okay, it just like it is so real, and nobody like once they're fast from that, they don't exactly address that issue because they've been through that. So they are like it is part of the journey, so you have to face it. There's no solution to it, but I guess talking about it is the first step to getting its solution. So this topic, this discussion is one of the beginner steps that we can take to solve that issue.
Yes, actually, the that you said that it is the first step to talk about it. So I think that's the main thing, and I am just so glad that we are talking about this issue in this session. And over to you, Dr. Namitha, for the conclusion of this session.
Yes, ma'am. Ma'am, it's not about Ayush professionals. It's about all the medical professionals. They deserve their health concerns to be addressed on a regular basis, ma'am.
Yeah.
On a daily basis. It should be addressed, because once we care for them, uh, the healthcare to the patients will be the quality of the healthcare to the patients will be in a much better and in a productive way. Even the doctor patient relationship will improve much more better. And even my brother is a doctor, and he works for hours and hours, and he says, I'm extremely tired, but while working with the patients, his focus will be on the patients. So that time everything changes. So we give our full efforts to the patients, but we are not dealing with ourselves individually. So we should look after ourselves. And as you told, we need to be trained to look after ourselves, because nothing is more worth than losing our physical, mental, and emotional health. That's what I would like to conclude, ma'am.
Yes. This is like crucial topic that we all need to talk about. This is just the beginning, and we are the physicians that are gonna talk about it. And I hope people just start witnessing all of these things, because they also need to speak up. If we don't speak up, no one is gonna help us. So just try to ask for help. And yes, that's it. So over to you, Dr. Kishnani.
So to conclude today's session, thank you so much, Dr. Namitha, for sharing your valuable insights on
Thank
physician
you, ma'am.
burnout and
Thank you.
shedding light on such an important topic.
It's my pleasure,
Thank you
but
for it.
before taking the topic, I was too nervous. Till the last minute, I was preparing, but I hope I just presented like what I wanted to tell from my heart.
It was amazing. It was just amazing.
Thank you so much, ma'am. Thanks for the opportunity, and I'm grateful to you, like, for.
Pleasure is all ours, actually. Yes.
Thank you so much.
Also, a big thank you to Dr. Rajvi for leading today's conversation with such thoughtful questions. And of course, thank you to everyone who joined us today for being part of this discussion. Conversations like these bring us one step closer to support the mental well being of healthcare professionals. With that, we officially conclude today's session. Have a wonderful day.